This is my brief overview of my case study, The Plight After Oversight at Community Medical Center. So the Community Medical Center is a small town family-owned practice. Dr. William Stern is the founder, and his wife, Mrs. Stern, was the practice manager. Their son, David Stern, also worked there as a physician. After about 40 years of working, Mr. and Mrs. Stern decided to retire, and they had to hire a new practice manager to take over Mrs. Stern's job. David Stern, the other physician, their son, had a friend he went to school with who had a daughter that has 10 years of experience and a master's degree in healthcare management. They decided to hire her. So some things about CMS are that self-pay patients are given a discount up to 75% off their office visit. His father mentioned something about lower reimbursement rates when he decided to retire, stating that he doesn't get paid as well as he used to, but he works more. Also, there was another practice in the area that shut down recently, and they were taking on the other patients with that clinic closing. So they only had one physician, Dr. David Stern. They had a physician assistant, and they had the practice manager, a couple nurses, a receptionist, and a coder, while working at the clinic. They lengthen the practice hours, and they open on weekends as well. Because Dawn is hired as a salary employee, she has to be present during working hours. Everyone gets along well, and the family practice really feels like a family for those who aren't part of the family. After working with Donna for a little while, Dr. David Stern tells her that he wants to meet with her and discuss the performance of she's had at the clinic after about 90 days. He talks about how well she's working and brings up the good evaluations on the surveys that the clinic has gotten in the past when his father, Dr. William Stern, was working, saying that he wants to continue getting good evaluations on the surveys. Donna didn't know about the surveys, but she didn't say anything to David because she wanted to appear like she knew how to do her job. So she decided that she would work on the surveys and finances, so when they went to meet up in another week or two, she would have the problem fixed. However, she could not fix the problem that quickly. So when she was working on the survey, she noticed that the low survey scores that they have now coincided with the practice closing and them taking on the other practice's patients. So because of that, wait times and quality of care were compromised. And she also found out that the revenue cycle is not working like it should. No one at CMS forced patients to pay in a timely manner, and the insurance wasn't reimbursing them either. After a while, Donna decides to talk to her dad, and he reassures her that everything will be okay and that she should tell David what's going on. So she opens up to David and explains everything to him. He gives her 60 days to turn things around. So Donna believes that Miss Stern misled her about how well the practice was doing. And because of that, she didn't focus on the practice's performance. She basically just focused on learning the management software system and getting along with the staff. Now that she realizes the gravity of her mistakes, she plans not only to fix her mistakes, but to make the practice excel beyond the level it's at now. So basically, there were obviously some issues with this case study. Having 10 years of healthcare management experience and also having her degree, you would expect Donna to know that there is more to the job than just learning software, and she should have jumped right in instead of focusing on becoming one with the staff more than anything else, and she should have focused on the revenue cycle, the surveys, everything else, that how the practice works and how things get done, what each person's job is, and all of that. CMS could have limited the number of patients they took on and referred patients they couldn't see to another practice. This would have eased the stress of seeing more patients with less doctors. This would also help lessen wait times and give Dr. David more time with his patients. Another issue that could have happened with the clinic is the shift from the volume of patients you see to the value in patient care. There could have been a disconnect in how Mrs. Stern ran things and how Dr. William ran things. Maybe they weren't quite communicating well, or maybe Mrs. Stern just forgot to communicate things to Donna, but there was definitely a lack of communication. And because no one in the clinic managed the day-to-day or long financial direction of the clinic's reimbursements fell well below what they should be. Most of Dr. Williams' patients were self-pay, could be seen as charity care or bad debt. He was providing a service that was going unpaid for, or at such a discounted rate there was no way to recover costs. Eventually, this would have caused Dr. Stern's practice to close, just like the other physician practice closed. Donna will also have to identify if the coder is using the proper codes and filing claims in a timely manner. Someone would need to be trained in following up with claims once they are filed to ensure they are processed or refiled and corrected if there are any denials. The surveys from the patient should be evaluated to figure out what areas the clinic needs to improve upon. The doctor should be given more time with the patient, and the goal should be to have the patient spend only the amount of time necessary in the clinic to accomplish their treatment needs. Other time should be reduced as much as possible. Treatment should not be overused just because a patient may feel it's necessary because the physician wants a good survey score. Other staff should be trained to create a patient-centered environment that delivers the best care possible to patients. So when the patient is checked out and has to pay, they are more willing because of the good experience they have. If Dawn and the other staff members help the patient see that paying is best for everyone, including them, they will be more willing to pay moving forward. Donna could use the PDCA cycle to improve the process of the practice management. This is something that was made famous by Dr. W. Edwards Deming. The PDCA has 4 areas: plan, do, check, and act. Plan includes identifying the problem. Do is when the solution is developed. Check is where the results are confirmed and studied. And act is when the results are documented, others are informed, and decisions are made based off of successful results for which solutions to implement. Each person at CMS also needs to fully understand the roles of their jobs and how to perform them. Job descriptions should be given each employee to ensure accuracy of their responsibilities, the main focus being on the patients and their experience at the clinic. Surveys should be monitored for improved scores, and documentation of what the patient enjoys should be shared with the staff to improve morale and teamwork. And these are my references. Thank you.